Hello, this is Robert, and welcome to my channel. I help you pass the OET. Whether you have failed, whether you struggle, even if your fluency in English is not good. I can help you, especially with the speaking and writing, and I use a unique method. Now, today's video is about the IMG, or International Medical Graduate process, especially in the United States. If you're a medical student going to graduate, or you're already a doctor, or another profession such as nursing, physical therapy, dietitian, ophthalmologist, dentist, and so forth, you may be able to qualify to practice in the United States or another English-speaking country. As for doctors in the United States, first of all, you have to make sure your medical school or medical university meets the requirements and that your degree will be credible in the eyes of the American authorities. You can look this up online and verify with the ECFMG, which is the Council for International Medical Graduates, to undertake the application process. If your medical school qualifies, you need to take the USMLE, or the Medical Licensing Examinations, Step 1 and 2. Now, Step 1 is about your basic science, and Step 2 is applying this science to clinical situations, to patient care. There is also a Step 3, which tests your ability to practice diagnosis and treatment totally independently, especially in outpatient settings, but you can take that later. Anyway, after you pass your steps, as they call it, and you do get a score, and they are interested in you having a good score, a higher score, you need to pass an English qualification. Now, depending on where you go, it's either the OET, which I mostly cover, or perhaps the IELTS. But for America, it's now the OET, or Occupational English Test. Like IELTS, TOEIC, and TOEFL, the OET has listening, reading, speaking, and writing parts. Many people are daunted by this. Maybe you never use English unless you're in a lesson with me once a week or something. You might not be that fluent. So you can pass the speaking and writing portions by getting it structurally correct. It's graded on a point scale. It's 39 points for the speaking and 38 points for the writing, which translates to a 3-digit score of 500 for a perfect A. Now, most places, you need a 350 to get a B to qualify. For IMGs going to the United States, you need a 350 on everything except the writing, and there, the last couple of years, you only need a 300. So that's pretty easy to do. Once you get what's called your ECFMG certificate, you're allowed to apply. It's an online process. It's rather expensive. You can apply to just a few programs. Some of my students have applied to 300. This is several thousand US dollars. Most people apply in the primary care specialties, like internal medicine, pediatrics, and family medicine. If you're a specialist, such as a surgeon or radiologist, people have matched, but it's much more difficult. Once you apply, you probably will get some interviews. I help people with interviews, and there's several parts to an interview. They may ask you to introduce yourself or tell me about yourself. This is not a way to recite everything on your CV. They have your CV. And by the way, you will be submitting your CV, or curriculum vitae, or resume, your personal statement, which is about a 1 or 1.5 page statement, and there's a process for that, which I also help you with. Letters of reference from your professors, which you usually write and then they sign, and you send this in. So you get some interviews, and there's about 5 kinds of questions, give or take. Introduce yourself. Why did you become a doctor? Why did you choose your specialty? Why do you want to go to the United States or the country in which you've applied? UK, Ireland, Australia, New Zealand. There's even programs in Qatar. So I can help you with this. People give a generic answer, but I will explain. And then we have the dreaded behavioral questions. What would you do if you had conflict with a coworker? Very difficult to answer. They're kind of testing you. Now, about 25 years ago, this got really popular. I think they've eased off a little bit, but they still need to go through the motions. So I can teach you to answer behavioral questions. Along the way, at any point, people take rotations, fellowships, clerkships, and observerships in their country of choice, perhaps the United States. Usually you go there, but during COVID, it became popular to do these virtually. the in-person rotation is much better, but if you did a virtual rotation, I can help you write a constructive summary of your experience that will be plausible to the interviewer. So other things that we can talk about after your interview. Sometimes people want to write a thank you letter, and we can talk about that a little bit. And then hopefully you're going to match. When you match, some people come to me for help in presenting patients. You can do this whether you match or whether you're on some kind of observership or clerkship brief rotation in your country of choice. How to interview and get a good history of a patient in English. The way I usually practice is I'll be the patient. You come to my room, introduce yourself, you're making rounds. Then you ask permission to bring in your team. You bring in your team and I'm your attending, and I may ask a couple of questions. And then I will say, as you're attending, let's go down to the doctor's conference room and talk a little bit more. So these are some of the services I do. I can also help you with any kind of medical writing, business writing, medical English. People from, for instance, the pharmaceutical industry, either on the business side or the scientific side, have got me to help them, and I've enjoyed doing this. So this is Robert. Welcome again to my channel. If you enjoy this content, like and subscribe, and I hope to see you soon.